Now, South Africa's National Health Insurance, or NHI, remains in its foundational phase, heavily stalled by legal and financial uncertainty. The NHI Act was signed into law in May of 2024, but it is far from operational, with at least 9 active court cases seeking to challenge its implementation. Joining us now to discuss the legal battlefield and the road ahead for the NHI is Dr. Kgosi Letlape, an ActionSA Member of Parliament and Health Portfolio Committee member. Dr. Letlape, a very good morning to you and thank you so much for your time. So many South Africans are still quite uncertain about what the legal challenges mean for their access to healthcare. Perhaps take us through these and how might these court cases affect the average person's ability to receive quality healthcare services in the near future?
I think we must just be mindful of the fact that NHI is not for all citizens, as it is proposed. We as parliamentarians have our own medical aid, so we will not be impacted by NHI in the beginning. And you have to ask yourself a question. Why would you create a system that you are not a part of? And that is the fundamental problem that we have. That we have a situation where we're creating something for others and not something for all of us. So that's the basic issue that South Africans should be mindful of. The second issue is that health is a contested area where huge profits are made by participants that don't deliver care but administer care. And when you look at the core of what is being proposed in NHI, you are creating a fund. You are not fixing healthcare. You are concentrating on one component of a healthcare system, which is the money. And currently, our biggest problem in South Africa is not the absence of money, but it is how money is spent, how plans are made, how patients are sacrificed, how providers are sacrificed, and there are players that make huge profits from this. So it is the profit makers that are going to court. And you must also understand that the way it has been formulated, it has been formulated that there's an emphasis on the money and the management of the product. If you think the disaster we have in Tembisa is a major disaster, it's a small thing compared to what will become of NHI as it is proposed.
So, Dr. Letlape, I mean, you speak about the healthcare system being a contested area and mainly those that administer the care, not necessarily provide healthcare, being those that are at the helm of being the key litigants. I mean, in some of the cases we see here, Discovery Health, as well as the Democratic Alliance. So maybe how could these ongoing legal disputes delay or maybe derail the progress towards universal health coverage? I mean, you also speak that it's not a system that necessarily would work for ordinary South Africans. So what do you think is the better proposal here?
When you analyze the activities that have occurred around NHI and the pilots that have been done, the focus has been on trying to fix the public healthcare system. Now, if Parliament was honest about what should be done to improve universal healthcare, the focus and the message should be we're fixing the public healthcare system for all of us. NHI means all South Africans, all citizens will access the public sector for no payment at the point of service, and we're going to fix it for all of us. So we will be pledging solidarity with those that have means, those that don't have means, those that are employed, those that are not employed, those that can speak for themselves, and those that can not speak for themselves. That we become one as South Africa. When you look at the pilots carefully, you'll see that this were constructed to try and look at certain aspects in public service. Now, if you had good intentions, if you had sincerity amongst politicians, sincerity amongst the parties that govern, the focus would be to give universal health care. We must fix the public healthcare system, and all of us as politicians and all of us as citizens must use the public healthcare services for our own care. You'll be amazed at the tremendous impact that would have on many aspects. For example, when you look at remuneration, one of the things that people want when they work, they want medical aid. Now, when you fix the public healthcare system, and it's accessible to all of us, people can do as they please after paying their taxes with their money. You don't have to get involved. You don't have to offer anybody any medical aid as an employer. The commitment would be to collect taxes, to improve our public healthcare system, to improve how it is funded, to improve accountability. You think about it. When you are poor and you're out of work, then you have universal healthcare, because then you can go to the public healthcare system. So why don't we fix it? Go back to the future where people that were seriously ill, irrespective of their level of income or their position in society, access a quality, wide public healthcare system that served all whites. That's all you need to do. Now, the problem that people do not understand, it is this creation of the pot of money. Now, let me give you an example. When you create the fund, you are basically almost creating a pseudo-state enterprise. And when you look at the governance of that state enterprise, it comes under the power of the minister. So it becomes a political fund that can be politically controlled. Where the board is appointed by the minister, everything is now under the minister. Even parliament would be blindsided by the governance proposals of NHI. And once you've created the state entity that you don't use yourself, you still have your PAME, you still have your medical aid, you're still going elsewhere for your healthcare, that becomes a nest egg. That becomes the next pot of honey for looting.
So Dr. Letlape,
arrangements that you have right now should make us all fearful and scared.
And I hear you, Dr. Letlape, and maybe just to add on to some of the issues that you're raising, I mean, we are seeing a lot of the times some of these civil society organizations, Operation Dudula March and March, that are calling for certain access with regards to healthcare, especially when it comes to illegal foreigners that have come through South Africa's borders. Other critics argue that the NHI challenges just that highlight deeper concerns about our constitutional rights. So with these legal cases and the financial inabilities for NHI, does this threaten or reinforce South Africa's constitutional rights to healthcare?
No, it doesn't. It pays lip service. Because when you create NHI, you're creating a honeypot. When you're creating NHI, and you are not ring-fencing it for citizens, and you have this philosophy of South Africa belonging to everyone who lives in it, that no one can be denied care at any level in our society, then you have something that is not fundable, something that is not working. You now have a government that is into internationalism and hooliganism, basically stealing whilst trying to be international darlings by saying South Africa is open to everyone. Those that are saying it's open to everyone don't go to those public services that are overburdened by the numbers. They are now opening them up to the rest of the world, or in particular to the African continent. That is disingenuous, that is disrespectful to citizens, that is malicious. And it is time South Africans began to connect the dots. If it is not for all of us, ab initio, why do you want to call it nation? When it's a system for the poor that will be fleeced by the rich.
All right, Dr. Letlape, thank you so much for your time and joining us this morning. That is ActionSA Member of Parliament, as well as the Health Portfolio Committee member, speaking to us there about some of the litigation that we are seeing when it comes to the National Health Insurance Fund.